Hello everyone. I'm Uma Sarder, a data science graduate student in School of Applied Computational Sciences at Meharry Medical College. Today I am here to present our work, which focuses one of the critical public health challenges of our time, maternal health outcomes in women with substance use disorder and pre-existing health conditions. Maternal morbidity, particularly in vulnerable population, is an area requiring urgent attention. Our research utilizes data from the NIH All of Us initiative to explore how substance use disorders such as opioid, nicotine, and cannabis use, along with pre-existing health condition, contribute to adverse outcome like preeclampsia during pregnancy. At first, I will give you a little background. So, the substance use disorder during pregnancy poses significant risks. Previous research highlights that women with substance use disorder and conditions like depression, liver failure, thyroid stimulating hormone, renal failure, and blood clotting disorder face compounded risks during pregnancy. Those women are more likely to experience severe maternal morbidity, including such as gestational hypertension, preeclampsia, and hemorrhage. Our study expands on this by examining the interplay between substance use disorder, pre-existing health conditions, and maternal health, especially focusing on preeclampsia. Now I will explain um, how we design our study and our analysis method. So we conducted a retrospective cohort study using EHR record from NIH All of Us data. Our cohort includes 12,879 pregnant women, the aged between 18 to 55, identified using ICD-10 code for pregnancy-related conditions from January 1st, 2018 to December 31st, 2023. So the key predictors include various substance use such as opioid, cannabis, cocaine, nicotine, alcohol, along with a pre-existing health condition like depression, blood clotting, TSAs, renal failure, liver failure. To predict preeclampsia during pregnancy, we employed a range of machine learning models such as logistic regression, linear discriminant analysis, k-nearest neighbor, naive Bayes, and support vector machine. We used a word ratio and 95% confidence interval to assess the strength of association between predictors and outcomes. With support vector machine as the top performing model with an impressive 91.6% accuracy. So the key findings from our analysis was the minority women, especially Hispanic and Black women, are at higher risks of developing preeclampsia compared to white women. And substance use disorder prevalence varies across demographics, with white women more likely to be diagnosed with nicotine use disorder before pregnancy, while Black women showed higher rates of cannabis use. Depression, liver failure, and blood clotting disorder were the most common pre-existing condition in this cohort, with Black women having higher rates of renal failure. Age showed an inverse relationship with preeclampsia, indicating younger women are more prone to this complication. So to conclude, we can say we found a strong association between substance use disorder, pre-existing health condition, and adverse maternal outcomes like preeclampsia. The disparities observed among racial and ethnic groups call for targeted intervention to reduce those risks. The support vector machine where the performance was 91.6% accuracy offers a promising tool for early detection and management of preeclampsia in at-risk population. So for future research, um, we want to include some social determinant of health and other health conditions. And the socioeconomic factors here, the area deprivation index is also very important, and we found negative association which needs further investigation. So um, to acknowledge for the acknowledgement, the work is supported by HRSA and NIH P50 supplement grant. And I would also like to thank you, our School of Applied Computational Science and Meharry Medical College for their continuous support. And I would also like to thank NIH All of Us Research Program and for their participant for allowing us to use their data and the computational infrastructure. Thank you very much for your attention. If you have any question, feel free to reach out to me.